lump right there, but it's like
Yeah.
it hurts
Moved
so off
away.
right here. Uh-huh.
Sorry, look at this one. Okay, put it down. How about, do you hurt here too?
No.
Just,
No.
no? So you have a port here. Okay. So actually, the bone scan, it shows that yes, there's a problem with this bone here. So
Cancer or?
yeah, that's what it looks like. So
Dr. Pataki said it would be very rare to have cancer in the leg.
okay, so this is the X-ray of your skeleton. You know, this is the scan that was done, and you see this.
I see
Right
it.
there.
Yeah, you see this area,
Uh-huh.
right? Okay. See, this normal is there's no highlight here. It highlights right here. It highlights here on the second rib on the right side. You can see there's a highlight here, but there's an intense uptake here. Okay, and so if somebody who had a previous diagnosis of breast cancer or lung cancer, and if a lesion like this shows up, this is cancer on the bone. That's what it looks like. Okay, and then we take them like more advanced picture. You can
I
see,
see
you
that.
know. So they say all this. Okay, so either this is a cancer in the bone, or there's an infection in the bone called osteomyelitis. Osteomyelitis can sometimes look like this, but my problem is with this much going on. Okay, listen. I don't like to say bad things. Okay, but bad things happen to good people. Your risk of breaking the bone is very high.
Compound fracture. Huh?
Absolutely, her bone is gonna snap.
And she has thin bones anyway, so
Yes, with as much damage has happened, you're gonna break your bone. So what this means is you should not be walking, climbing, climbing the stairs, going down the stairs. In fact, when you come down the stairs, you put your body weight on every time. You take a step down. It's gonna snap, or it can snap. I hope it doesn't happen. So how do we fix it? I think you need to walk with the help of crutches. Okay, not to put weight on this leg. That's the only way you can save it. And Dr. Pataki, perhaps you need to give radiation to zap this area. And sometimes even all that is not enough, and then you may have to take, you do surgery, they have to put a plate. Yeah, like metal plate inside the bone to protect from.
can I ask you something?
Yeah.
I know she don't want me to ask questions,
Yeah.
but if you open her up to put a plate in there, won't it spread even worse? Okay.
Right. Is Dr. Pataki here today? Okay, for this. Okay, good. Okay, thanks. Great. I would not want her to have surgery done because you try to open it up and an additional problem happen. What if she gets infection or after surgery, there's a wound healing problem or something, right? So my preference would be, let's hope we don't have to have the surgery done. So I just checked with Carrie. You have an appointment to see Dr. Pataki after you get done with me. He will look at the bone scan. If you can safely zap it, go for it. My only suggestion to you is, don't put weight on this leg, it's going to break.
What about a walker? I have a walker.
No, but see, think of it this way. Unless you're going to use a walker and you're going to keep your leg up and walk on it, you cannot
We got
put
two
your
steps.
Yeah. You need to have crutches. Please get you can get from this pharmacy. You get a pair of crutches. Okay. So if you walk with the crutches, you need to protect your leg. Don't put weight on it. Okay.
A brace? Can she get a brace of any sort?
But see, again, with the brace, you're basically
still
trying to. Yeah.
I gotcha.
Yeah.
Now we'll
All right. So let's see what Dr. Pataki has to say. Okay.
Okay.
But with this much intense appetite, I'm worried. There's a chance he will probably do additional imaging study. Maybe he will do X-rays more to see how. Because on this scan, I can see there's an intense uptake. It does not tell me how much the bone is thinned out. Okay. So because see what happens is, all right. Suppose we are looking at the bone. So this is the marrow space and this is the thickness of the bone. Okay. So this scan does not show me how much thickness has lost. It shows this all it looks bad. Okay. So he may have to do additional studies to see how much thickness is lost. if your thickness is almost lost, then perhaps you would need to have surgery done as well, put some hardware on. But you still have enough thickness left, then perhaps you can just zap it with radiation and hope for the best, Let's see.
But what would they do? Give her an X-ray, another X-ray in here?
X-ray, and then you need to have radiation.
What about this blood work that was taken?
So the blood test we do, I'm okay with that. I looked at the blood test. Nothing surprising or bad about the blood test. Let me pull this up again here on the screen. Alright.
The
If
one
he,
that you were waiting for from Massachusetts, has it come in?
No, that has not come
Oh
back.
Lord, I thought
I
that.
thought it came in. Carrie told me.
Oh, really? Okay.
Yeah, Carrie said it come in today.
It did? Okay.
I think that's
Right, let me
that's
ask
the way I
you.
understood
It's
it.
like they were scanned it and you part of it find out.
Well, radiation, save that bone or whatever. Help it. Quit
Well, he doesn't know
hurting
how
more.
thick it is now, but we know her bones are already brittle.
It should have come a long time ago.
Dad, she had a bone density test and everything. I mean, you just.
No, when she first started work.
Well, I mean, she has such bad veins in her legs and everything. We didn't know.
I should have made her come.
Y'all do everything you possibly can all the time with doctors and everything.
That's all I do is see doctors.
Right. I mean, it's not like you have neglected anything. It may have been a different
I
type
didn't
of.
know it was that critical. Oh my God.
What,
I
Dad?
kind of knew it when I saw the X-rays when I got the scan.
That critical that it will break.
No, I didn't know that.
Then you'd have to get an operation. Needle.
Hush, Dad. She's already stressed out. We're stressed out too. I mean, I know. He looks like he's had a hard day today by his eyes.
Mm.
I can't imagine how he feels going home at night knowing that's out there in the office.
Yes, it can. I looked at the screen.
Okay.
So she does have a type of DNA change is called PIK3CA, PIK3CA. So patients who have this particular mutation, they benefit from it. There's a pill for that. Instead of taking intravenous chemotherapy, there's a pill that you can take.
And
But okay, here's the thing. That treatment works very well for breast cancer, but does not work as well for lung cancer. You have both. You have breast cancer as well as lung cancer. So the
I thought that breast cancer was in remission.
okay, so breast cancer is in remission, but now with the development of the lung nodule and the bone, the lung nodule will be biopsied, and it didn't look like breast cancer, it looked like lung cancer. But when the PET scan, we saw other areas. Okay, so now the other area, there's a possibility they might all be from lung cancer, or they could be from breast cancer as well. My experience has been when the breast cancer comes back in some patients, it comes back silently. It just produces it.
Real bad.
It comes back silently, slowly, and would not produce any symptoms. Now this lesion on your leg that has happened, it could be from breast cancer, it could be from lung cancer, one or the other. The only way we would know for sure is actually if we were to do a biopsy, take a fragment of bone out and send it for the test, which I do not recommend. Okay. All right. So here's what you need to do. I'll let you have the radiation first, and then one day after the radiation is completed, we're going to prescribe you the medicine for this
Yeah.
This test we found, the DNA test. Okay.
For the what?
For the pill.
They're going to prescribe the pill for you
After you get the radiation. if
after
she
the
gets
radiation.
it, Or now.
You don't recommend chemo then?
No. I recommend this pill.
And
You feel good about it
Yes.
does she start taking it now or after?
after the
After the
radiation?
Okay. And the pharmacy's got that pill?
Yes.
And she's taking the pill because you don't know for sure whether it's
How much it
caused
works.
from the breast cancer or the lung cancer, right?
Well, she'll be taking both of them then.
I do take that one every day. That
If that was
So
breast
his-
cancer down here,
Okay, so here's what I wrote down. Okay, guys, pay attention, please. Okay, this is the mutation we found on the test we sent to Massachusetts. She has called the PIK3CA mutation. The treatment for this is an oral medicine called Piqray, and along with this, there's a shot. So oral medicine she will take daily at home. The shot is given here at the cancer center once a month. Okay, once a month.
And what type of shot is that?
This is a hormonal shot for breast cancer.
Okay.
And this is a pill that works to block this mutation.
do
this shot helps out her breast
I
cancer.
ask you?
This
all
pill-
to ask
Yeah, I'm
questions?
on that. Ask
Okay, go ahead.
questions,
He
too.
wants
Okay.
us to pay attention.
Yeah, this pill would not work unless the shot is given.
Okay.
So this shot helps potentiate the effect of this pill. Okay. So usually we recommend taking this with this together. Okay, it's a once a month shot here
Right.
in the office. We do
And
it
the
at
other
work.
the pill is every day.
Pills every day, take it at home.
What about the one I'm taking? I still take it.
Yeah.
Okay, the one you're taking letrozole? No, letrozole or anastrozole.
The one you
For the
recommend.
For 5 years.
Yeah, 5. So we will stop that pill because this combination will substitute for that.
Okay, but we'll stop it when I start
Correct,
this.
when you start this. So keep on taking it for now until it's time for you to start this one.
Okay. And what are the side effects do you know?
So the common side effect is diarrhea, fatigue.
Mhm.
Some people get skin rash. Okay, some people will get it nausea with it.
I'll get all of them.
Lots
I
of
know
them.
me.
Okay. Some people get skin rash with it.
Mhm.
So before you start taking this medicine, we will give you written information on this medicine.
Mhm.
You will have to give us a signature, the consent form. Okay.
Mhm.
And after this is done, then this will be sent to a specialty pharmacy because this is a very expensive medicine.
Mhm.
1 month supply is more than $10,000.
Oh my God.
Okay, it's very expensive medicine.
Does my TRICARE for life cover something like that?
Yes, so what we will do, we will call TRICARE, we'll get authorization, we need to support, give them the documentation. We should tell them why we've done because we found this on it.
Okay.
Right, and that's a good thing
Correct.
that we got that.
So once we give them all the information, then they will authorize, otherwise they will not authorize. This medicine is so special, you cannot get it from Walgreens, Walmart, any other pharmacy. It has to come from a specialty pharmacy.
Right.
Right. Can I ask you something?
Yeah, please.
I know that, and I know that, you said, oh, we don't know whether it's come from the lung cancer or the breast cancer. So we're just hoping for this medicine to make an improvement.
Correct. Both these cancers can go to the bone. Okay, lung cancer can go to the bone, and breast cancer can go to the bone. But if I have to choose one, which is most likely, it is the breast cancer.
Mhm.
Especially the type of cancer of the breast she had. That type of cancer loves to go to the bones.
Okay. And I appreciate you telling me that then. Yeah.
Mhm.
Thank you.
But you're welcome. But
Thank
you know,
you.
but as you said, that if we really need to know, the only way we know what's in it is to take a sample.
And we're not gonna
And
worry
which
about
I
that.
which I do not recommend.
Right.
Right. Now, if she gets radiation on that, will that pain go away? In
Oh,
her?
absolutely, yes.
But she'll still be frail there.
She's still there.
Because from the bones, the density scan, they've already told you the
Yeah, very
osteoporosis.
thin bones. Yeah.
I'm sorry, my dear. Listen, as much as I love you as my patient, I'm sorry to see you going through all this.
I can handle it.
And I can tell that you've had a really stressful day. I can tell by your eyes.
You know, actually, as a cancer artist, I'm telling you, it's not easy. You know, so
I can't
No,
imagine.
you got
because you know,
bad news every day.
yeah. I mean,
See people
we
wanting
have-
to live
we
and
have
they
good
just want
news
to
and we have
live.
bad news. It's really sometimes it affects me emotionally as well.
None of it's good.
That's
You know what I'm saying?
So mine's been working pretty good.
Yours is good so far. So sometimes we have patients, you know, we have been seeing them for a number of years, so we get attached to them, you know, and then we have the things that we begin to see in the scan, the blood test is not good, so that hurts. It's hurtful.
I can imagine.
Well, I like the thought of the pill and the injection.
We've got to
But
be very
if it
careful.
starts feeling good, you'll forget that you really got it.
Got to do something about that.
The way you want to work in the house and everything.
All right, do you have a wheelchair at home? A wheelchair.
No.
You need to get one. I don't want to.
Can you prescribe one? How does that work?
Okay, so I'll write it down on this. You take it to home supply company, like,
Uh-huh.
you know, and they'll give it to you.
Yep. Mom, this is good for if you have to like coming in here.
But he said that even afterwards, I will
That's-
have to be careful.
That's fine. You're alive. Okay? I know it
I
don't
got her
sound
one of
good.
these scooters.
He said no.
No,
Okay, if you sit on the scooter, that's fine, but you cannot put your weight on your leg.
Yeah, like that little one we were pushing. I was thinking if I had that here, you could just sit on it and I could just push you.
I mean, that's what I do not recommend you should put weight on it. So,
We need to talk to Patakia and see about how. Okay, I'm sorry. I'm have both of y'all in my blood. I can't help myself.
Dr. Patakia says it's very rare to get cancer in your
it's
legs.
Well, you're a rare person.
Drop that, okay?
Thank you.
That's what he
That's
told
another
me.
story.
Or in your arms, he said.
alright, let's see.
Does she need to get a pair of crutches out here?
She can get crutches from that place as well. You know, actually, best thing to do is, I'm sure you have a circle of friends, right?
I got crutches at the house. I
Okay,
think.
yeah. You can actually sometimes you send a message like on your neighborhood
Facebook,
or
yeah.
whatever. You say, anybody has a wheelchair to spare?
It's
Or,
not like they can't afford it.
no, but I know. You will be surprised. Actually, both my parents needed a wheelchair, and we just put it on the. There were so many people say, "Oh yeah, we have a wheelchair. Just take it from us and all that." And so only after my dad passed, so we donate all this stuff to other people.
Yeah.
You know?
My sister-in-law's mom just passed.
That's $10,000 a month. That won't last long.
You can tell he's had some bad news to tell people today by his eyes.
Do what?